Chronic kidney disease. We have already discussed about what is chronic kidney disease, the symptoms of chronic kidney disease, and something more about chronic kidney disease in our previous videos. Now, chronic kidney disease has got 5 stages. Stage 1 to 5, or say before 5, 1 to 4, are considered as the conservative management stages in case of chronic kidney disease. And stage 5 may progress into dialysis, that is either hemodialysis or peritoneal dialysis as the patient chooses, and or the patient may choose go for a transplant. So stages 5D, that is dialysis and transplant, are a different kind of diet. But when it comes to stage 1 to 4, it is the conservative management or the non-dialysis diet in case of chronic kidney disease. And we are going to discuss about this non-dialysis chronic kidney disease diet in this today's topic. So namaskar, this is Dr. Suniti Khandekar. I'm an MBBS clinical nutritionist, MBA hospital administration, author of 3 books on renal nutrition, and let us discuss about the non-dialysis diet. Let's begin. Indian Diets and Kidney Diseases welcomes you for the topic Diet for Non-Dialysis Chronic Kidney Disease. Let us begin. So basically, optimal diet for a non-dialysis chronic kidney disease patient depends on the patient's estimated glomerular filtration rate, that is eGFR. It depends on the type of kidney disease, whether the patient is proteinuric or non-proteinuric. Proteinuric means whether the patient is losing proteins in his urine or if he is not losing proteins in his urine. So the protein intake of the patient is calculated according to this symptom. It also depends on presence of other comorbidities if the patient is having, such as hypertension or heart disease or diabetes. And for most of the chronic kidney disease patients, the diet should consist of whole grains, fruits, vegetables, legumes, milk, eggs, poultry, and fish. It should be calculated in terms of calories, in terms of proteins, in terms of fats, whether the fat is coming from oil or ghee, whether it is coming from saturated fatty acid sources or unsaturated fatty acid sources. Everything needs to be calculated. So you need to meet a qualified renal nutritionist or a dietitian for this kind of a particular diet. Now, dietary recommendations for non-dialysis chronic kidney disease diet are proteins. If eGFR is less than 60 ml per minute per meter square, then 0.8 gram per kilogram per day of protein is required. If eGFR, that is estimated glomerular filtration rate, is more than 60 ml per minute, then same as general population with the area or the particular community is having. Salt. Now again, here eGFR is being taken into consideration. So if estimated GFR is less than 60, there is volume overload, there is hypertension, there is increased protein excretion in the urine, then the sodium intake. Mind you, it is not the salt intake, we are talking about the sodium intake. The sodium intake should be less than 2 gram per day. Or if we talk about the common salt, that is sodium chloride, then 5 grams per day of salt can be taken by patients not on dialysis. If estimated glomerular filtration rate further reduces, but no other symptoms are present, then the sodium needs to be 2.3 grams per day, or it could be measured as 5.75 or up to 6 grams per day of common salt. Potassium, most important. It is based on serum potassium levels of the patient. So regularly having kidney function tests at least once in 3 months give you an estimate as to how your body is reacting to a particular kind of a diet and medicine. Potassium restriction is not required until eGFR decreases to less than 30 ml per minute per meter square body surface area, or if the serum potassium levels are within the normal range, that is 3.5 to up to 5, then potassium restriction is not advisable. But if the patient is susceptible to ranges of high and low potassium, then they need to be watchful about the intake of potassium. Now, potassium comes from the fruits, from the vegetables, from the dals and various sources. We will discuss about potassium and its various sources in our upcoming videos. So stay tuned in to Indian Diets and Kidney Diseases by Dr. Suniti Khandekar. Calcium. eGFR, if less than 60, calcium needs to be up to 1000 mg per day. If calcium is up to 2000 mg per day, it may cause positive calcium balance. Extra calcium is deposited in the tissues. It leads to metastatic calcification. So, excess of calcium is also not required in case of CKD non-dialysis patients' diet. Phosphorus needs to be calculated and given based on serum phosphorus levels. The intake should be 0.8 to 1 gram per day. Inorganic phosphate, as in highly processed foods, should be completely avoided. So, ready to eat processed food items are not recommended for routine people. So, for chronic kidney disease patients, it needs to be completely avoided. Fats. Now, less than 30% of the daily diet should come from fats, and out of that, less than 10% should be of saturated fatty acids. Calorie intake should be adequate. It should be 25 to 35 kilocalories per kilogram per day. Even if the patient does not feel like eating, he feels that he is tired, lethargic and खाने की इच्छा नहीं हो रही है, still energy intake or calorie intake needs to be maintained in case of CKD non-dialysis patient's diet. Fiber intake is good in Indian diets, but it should be taken as to the requirement between 5 to 38 grams per day, and same as in general population, it should be given, because low fiber diet may cause hyperkalemia, may cause constipation, and it may cause further problems in case of our patients of chronic kidney disease. So if you have any other queries about chronic kidney disease and its diet, we have 3 books on renal nutrition: Indian Diets and Kidney Diseases in English, किडनी का स्वास्थ्य हिंदुस्तानी स्वाद के साथ इन हिंदी, एंड किडनीचे आजार आणि भारतीय आहार इन मराठी, अवेलेबल ऑन Amazon, Flipkart, Notion Press, in Gram, in India as well as abroad. Think Indian, my dear friends. Think Indian.